Settle. Okay, stream is live.
Okay.
So we're good to go, Dr. Ines. And good morning, good afternoon, good evening, everybody, and welcome to a November edition of our Career Showcase at Digital Health Skills for Africa. And with me today is Dr. Ines, and we'll be chatting all things public health, digital health, and of course, career trajectory in digital health. So, our Digital Health Skills for Africa, we are championing the digital health literacy of mid to early career healthcare workers on the continent. So, this is one of the flagship programs we have where we speak with people who are already on this path to help us understand how they got on this journey and also how we can also get onto this pathway that they're already on. So to kick off things, I'm just going to do a very brief intro of our speaker today. We'll get to know her within the course of the conversation. So, Dr. Inas is a digital health professional, a public health expert with over 12 years of experience across the MENA region and Africa. She's worked across public and private sectors, international NGOs, and multiple UN agencies. She currently serves as Senior Technical Officer at Africa CDC. I'm not doing her justice. There's a whole lot more that we're going to learn and discuss with her. So thank you so much, Dr. Inas, and I'm so happy to have you join us today on this conversation.
Thank you so much, Isn't Actually, I'm honored, and I really want to thank you for this opportunity. And I hope the discussion that we have over this 1 hour could be helpful to someone, inshallah.
It is always helpful, definitely. So, as usual, my name is Izine Vision. I'm the Executive Director of Digital Health Skills for Africa. So, Dr. Inas, you going through your bio and your experiences, you began your career in public health. You're a physician, and then now you're deeply involved in digital health, especially in the MENA region. And so, what triggered your shift into digital health, and how did your background in public health shape this path that you took?
Well, I didn't think actually the shift to public health was intentional. It was like a smooth shift because of what when I was working in public health, all the time you witness the gaps in the traditional approach when you want to solve any public health program, and I think the shift to digital health was something step by step that I took, but I think the time of the COVID-19, it's not only for me but for everyone. We witnessed the gaps, and it helped us see how the traditional approach couldn't actually solve any public health issue. And if digital health were integrated by then, a lot of healthcare system, the services could have been continued without disruption. But I think the beginning of my journey in digital health came because I was involved in Health 2.0 Egypt chapter, and during the time I got exposed to a lot of experiences from people trying to solve different problems and issues with technology, and how to improve the quality of the healthcare provided through technology. So I started realizing that you could solve a lot of problems away from the traditional way that we usually learn in medical school and in public health. So I think, but the time of the COVID, I was actually working with Save the Children. I was working on a project to facilitate healthcare services for refugees. And when COVID hit, we couldn't actually continue the care. And at that time, I realized that we need a health record system. We need telehealth. We need a lot of digital health services in order to continue the care for refugees and other actually people living in Egypt at the time due to the lockdown. So I think that was the time where I realized that a lot can be done through digital health. So digital health is like a vehicle, so you can achieve whatever you want to achieve through public health. But I think having a public health background was quite important because, as I mentioned, digital health is the vehicle, but for you to be able to design a solution that is patient-centered and user-friendly and something that can actually help people within their journey receiving the healthcare, you need to have the public health background. You need to understand how to solve this problem and how to design a solution within the concepts of public health, within the equity, having ethical lens, understanding the population needs, and understanding how this solution could be sustainable and help other people around. So without having the public health lens and the public health background, you will be like more of providing a product or selling a product for patients rather than building a solution for a sustainable solution for population health.
Like that. So we shouldn't we should rather provide a solution instead of just selling a product. And that comes
Exactly.
from having that understanding and that public health background, or even that healthcare background, so that you don't just build for people who don't need it, but you solve problems for people who have problems. So that's
Exactly.
a very lovely analogy to give. And from what you've observed, what are the key gaps, especially in the Northern African region? What are the key gaps that are in the healthcare system, in the digital healthcare space, that in the healthcare system that digital health can help fill? And how do you see healthcare practitioners that are in this space helping to fill those opportunities?
Uh, well, okay, so basically, I don't think North Africa could be like y- we cannot deal with North Africa as one unit. Like we cannot ignore that. Okay, despite it's one region, because we usually have Africa in north, west, east, and center and south. But North Africa is a diverse region, and each country has its own challenges and its own, let's say, not just the challenges, but the ecosystem around digital health and public health in general is different from one country to another. And even within one country, if you go to different regions, you find a lot of differences and disparities. But the common things, I think, now that we all witness, not just in North Africa, but also within the different regions, that we have unequal distribution of services and also within the workforce. So we have a lot of capacities, manpower, and we have a very good specialized workforce, but they either do not work in peripheral areas, so there is a huge problem of centralization, or they had to leave the continent for different or other better opportunities. And I think this is a problem, a huge problem we have in North Africa, in Egypt, and other countries, because it's not only we need doctors and specialized doctors and health workforce to be there in the country and to serve the community. But also, if you look at the community in terms of refugees, people from rural areas, peripheral areas, and different minorities, they don't have the same access to the services and especially quality services. So I think this is a major problem, and this will definitely translate it into the continuity of care. So if you don't have a distributed services in terms of the quality of the services, workforce, specialized trainer, people, and everything, so at the end, the continuity of the care would not be there. So I think digital health is key in this area because basically to connect people from rural areas to the center where the majority of the services are there, you don't have to go and build another institution, a medical health center or a unit, and bring all people to go there. You can just have like a platform or a telehealth services or a telemedicine. You can have a platform that connects and transfer data and also the expertise from the center to the peripheral, and sometimes even from the diaspora to their countries, to the home countries. So I think this is one major thing that could be definitely solved by digital health. I think also one other thing is we don't have a unified platform for patients, and especially patients with chronic disease, to have their data, and for the caregivers to be able to look at the data and then to take the specialized decisions that's based on and built on patient needs and personalized patient needs. And I think this is something that we can definitely solve by digital health. We have now our mobile phones collect data all the time. We have wearables. We have our data from the labs. We have medical records. We have the prescriptions, but we don't have a unified platform that you could have all your data, so you can use it. Whether you change the hospital, you go to a different doctor, or you go through other kind of services in digital health, or even with the traditional approach, healthcare. So that's why I think having a unified platform within the country, and then maybe could be an interoperable platform that can be used from different platforms and healthcare centers is key, especially for chronic disease patients. So I think these are the two major challenges that I can see from the region, that I believe digital health could be a very good opportunity and solution for them.
And how do you see professionals coming to solve these problems? What the opportunities is there for health professionals to solve these
Yeah,
problems?
yeah, of course. So, for an instance, if you're a doctor and you're working in a hospital, but you also have an access to a platform that could provide some sort of like a telehealth services, you could serve other populations in the rural areas, or refugees, or during the war. This could definitely be an opportunity. And I have actually been working in a digital health platform in the MENA region called Al-Tibbi, and they were providing this kind of services, telehealth services, and especially in the times of war and a crisis, like for instance, what's happening in different areas in the MENA region. Without having this kind of platform and the telehealth services, those people would never be able to have access to care, especially with the mental health care, for instance. So there is a huge opportunity for doctors and specialized care workers to start using those platforms to be able to provide healthcare services for those who cannot afford it or do not have access due to the geographical location or war, conflicts, or even just because there is stigma around the telehealth service. Sometimes this could be the solution if you're in a country or in a situation where accessing services such as mental health or sexual reproductive health is highly stigmatized, then could be the telehealth service could be the solution at the time. So there is a huge gap in the traditional way of providing service that can definitely be approached through digital health. And also, I think with building platform, especially if we build a platform that is designed based on the patient's need and also the doctor needs, this is a huge opportunity for a lot of workforce to be developing such platforms, to look at the data and how to integrate them with different systems, to talk actually with the healthcare givers and understand what they need, and build some solutions and platform for them so they can have access to the different data and know how to utilize it for the sake for the sake of the patient. So yeah, I think this is a huge opportunity for people to work on.
And when you talked earlier about having a unified platform for chronic diseases, for data collection for chronic diseases, I know that you co-founded a startup that's focused on diabetes management using technology. And so, can you share the problem? Earlier, also, you mentioned about solving problems for people, not
Yeah.
just providing a product. So, can you share what problem your startup was set to solve and what lessons you've learned from building a digital health solution from the ground up?
Well, so Utida was born out of a very simple but urgent need. So, going back to what I've mentioned about chronic disease and especially diabetes. So, for you to manage diabetes, you need to have a medical plan. So, you need an endocrinologist to give you a diagnosis and give you a medical plan. But you also need a nutritionist to give you some advices on what to eat, what not to eat, and how to eat, and the portions, the type of food that you need to avoid. You also need someone to help you with your physical activity because you need to be physically active. You need someone who give you health education about your disease, about complication, how to avoid them. You need a community. You need someone who share the same health problems like you and to discuss this with you. So in order to have all this, so this is the management of diabetes, but usually in the biomedical medicine, we just focus on the medicine. We just focus on the disease. We focus on how to treat it through medicine, and we ignore usually the rest of the management. And this is not because doctors would love to ignore it, but they're not trained to provide this kind of care. They're not trained to provide this the continuous care and the comprehensive care management for people with chronic disease and particularly diabetes. So UTIDA basically bridge this gap. So UTIDA brings doctors, nutritionists, physical coaches, trainers, health educators together to provide a comprehensive care plan for a diabetic person. But in order to make this on the ground, like physically on the ground, you need to have a room, you need to bring an endocrinologist, you need to bring the whole team together to sit, to collect million of data, to look at the data together and to come up with a plan, which is something that would cost a lot of money and it's not sustainable. So think of creating one plan to one patient and then think of the population level and how could you design something that huge and massive to a lot of people. It's something that costs a lot of money and time and would take a lot of time also from the doctors. So I think having all this in a platform was the key solution for this. So that's what UTIDA is basically doing. So we collect data from the patients, from diabetic patients through wearable mobile app, what they eat, what they do, and the medication that they have, and all the problems that they have. And then we have a platform that we integrate all this data together. We present it for the caregiver so they can take the decision, and accordingly, an AI would help us build an optimized plan that is personal to each patient. So at the end, the patient would have all his data with a comprehensive care plan designed by different people, not just one doctor, but from different caregivers. At the end, they have this comprehensive thing done without having to meet with different caregiver and without the caregiver have to meet together all the time for one patient. So I think this kind of approach without the digital health could be impossible because on the ground it costs a lot of money and would be difficult to personalize each and every care plan for one patient. So that was the key solution that UTIDA was trying to solve. And through this journey, actually, we didn't reach this point just by creating UTIDA. At the beginning, we were doing this like one by one. We're trying to learn. We build something, we get having the feedback from patients on the application, and then we try to evolve. So I think what I've learned through this, that you don't have one size that fits all. So you have a technology, which is something very good, of course, but you need to have the community perspective and the patient perspective in order to build something personal and patient-centric. So you cannot just bring one application from the West or from the US or from the UK and you change the language and it's becoming a friendly-based application. You need to build something purely from the community that you're targeting and to get the feedback from the patients that you're trying to serve. And I've also learned that sometimes you need to help doctors. Sometimes you need to help caregivers. Usually when we build something in digital health, we care a lot about the patient. We care about solving patients' problem. But sometimes the problem is actually with the caregivers. The caregivers cannot provide the care because they do not know how to do it, or they don't have the means, or they were not trained enough, and so on. So UTIDA, when we're designing UTIDA, we discovered that the problem that we put everything on the shoulders of the doctors and we're expecting them to provide everything, but they cannot do it. So sometimes you need to provide a solution for the caregivers as well as you're providing a solution for patients.
That's quite a journey, and thank you for all you do. These are things that we definitely need to help improve the health system of our continent. And just moving on, you are a Kofi Annan Global Health Leadership Fellow.
Yeah,
Congratulations.
thank you.
And you've been also a strong voice in public and digital health leadership.
Mm.
So, what barriers? I don't want to focus more on Northern Africa. I'm just going to say generally Africa, in Egypt and Africa, North America, North Africa, all the regions of people you've worked with. So, what barriers do women in these sectors or places you've worked with, or the offices or
Mm.
you've encountered, what barriers do they still face in entering or leading in this emerging space of digital health? And what
Yeah.
strategies have you seen work to
Yeah.
empower them?
Well, I agree with you that the challenges women face in North Africa and Africa and globally is just the same. We face the same issues globally. And yeah, despite the region might add different barriers and different disparities, but like the broad challenges are the same. So digital health is part of the STEM, like the science, technology, mathematics, and engineering, and this is domain is male main dominated, and so that's a challenge. But this is not the only problem. I think the problem that women are not so we don't have enough training programs tailored for women. And when I say tailored for women, I don't mean that we need to train the program differently to match with the mentality of women, because we don't have something different. It's not like we have a less IQ or something, but I mean that the way that we train programs, we assume that women and men have equal opportunities, and this is not the case. We build something, we either post it online, we keep it there, we have like sessions, learning objectives, whatever we need to have this from training, but we never thought of how we can make this accessible, easy for women, and attract more women. Even if it's physical training, by the way, we assume that if there's a training there, even if it's free of charge, then it's accessible for everyone. But this is not the case. We need to understand the challenges that women face in order to either learn this part of the science or how to navigate, because at the end, for a woman to reach this point in digital health and in the STEM domain, for instance, there is a lot of other challenges beyond training she will face that she was not trained to. So she's not trained how to, for instance, navigate the stereotypes and the misconceptions around being a woman in this area, for instance. And this not only hinders women's ability, but it also shape the mentality around women being in this. It affects the investors who want to invest in a startup, for instance, or a company that's led by women. It affects the recruiters. It affects a lot of things. So having kind of like mentorship or training that's tailored for women, targeting the key barriers that women face in this domain, is quite important. And I don't think that we have this enough. We might have one or two, and they kind of like have the same program, but maybe the title is targeted for women. But the design of the program is not designed in a way that actually target the key challenges that women face. And as I mentioned, the stereotypes around having women and the leadership for this domain is huge. And so, for instance, if you have a leader or a manager who's not managing the project properly, you would never link the gender with the manager unless the manager is a woman. So if you have a bad manager, you just call I have a bad manager. But if you have a bad woman manager, you would definitely mention that the bad manager is a woman. And this is how we're all trained. And this is how the society around us frame women. We are trained that some positions, some jobs are not made for women, but we never understand why. Like, what is the skill that me as a woman doesn't have to be able to do this? So I'm not yet a leader in digital health, but from what I witnessed around me, I think those are the main key areas. And I think we don't actually have enough examples around us, because for me to be able to navigate something, a challenge, I need to have an example, a woman example that similarly been through the same challenges, so I can relate and learn from them. And that's why I think having some sort of like mentorship programs were led by women and targeting women is quite important, because for you to be able to navigate things, you need to have someone who you can go back and ask and get the experience, get something that you would learn without being judged, without being afraid to say that you don't know. Because usually if you're in this position, you carry all this burden on your shoulder. If you're a woman, you carry the burden of the stereotypes, the misconceptions around you, asking question, how did you reach this point, and all those things. So having this kind of like tailored trainings, mentorship programs for women particularly in this area, is quite important. I've been part of a mentorship program actually previously on digital health, and I would love to see a lot of similar programs in the region on a different level, like for people who starting the career, people for mid-career, and even for leaders. Sometimes if you're a manager, people think that you no longer need trainings, but actually reaching this point, you need the training and the mentorship the most, because the level of the challenges that you face is higher. And this is where you need someone like a role model or an example that you need to be with and around. So you have this kind of like an ecosystem around you that's enabling for you to be able to navigate the challenges that this whole thing that men never experience and never been through. So you carry this while you actually carry your own challenges through work and then navigating the issues around funding, managing teams, achieving results, and all those things. So yeah, so I think having this kind of like tailored mentorship and tailoring programs is quite important.
And thank you so much for sharing those insights. And it's interesting how much having a mentor or someone you look up to can make a difference. And I know you are also part of the AWID, African Women in
Yeah,
Digital Health
yeah, that's actually the
mentorship
program I was
program.
referring
Yes.
to. Yeah,
And I believe that was quite instrumental in helping you to get to where you are and also
actually,
sustaining where you are. And I
yeah,
believe those sort of programs should be encouraged very much wherever. It's not an African thing, like you said. It's a global thing. Women
it is.
struggle everywhere. We have the same face the
Yeah,
same challenges everywhere. So that's
definitely.
quite beautiful insights you shared. So going back to the technicalities, health system strengthening has been a key area of your career. And how can African health systems effectively integrate digital health tools while maintaining quality, accessibility, and local relevance?
Yeah. Well, I think when you provide digital health solution for on a population level, you need to have definitely a strong clinical governance framework. You cannot just go and design something and give it to people without having this kind of like a framework, a governance framework that actually could be translated then to clinical pathway, clear guidelines, reporting system, incidents reporting system, and everything. So without this, having this, it's quite important to provide a digital health solution. It's the same thing as you're on a ground and you're trying to build a clinic. You cannot provide a clinic without having medical law, having codes, know who's doing what, the role of the doctor, the role of the nurses, and everything. The problem with the digital health that you think that you don't have this kind of the physical entity, so you're free to go, but it's actually more difficult because without having this governance framework, it would be impossible for you to define things, and it would be impossible for you to know what is clinically sound, what is not, and so on. So without having a clear clinical evidence base and clinical governance framework, it's impossible for you to work on such thing. And I think what is really important, not just to build a solution on an evidence base, but also to be evidence informed. So because of you're dealing with a huge population, you need to make sure that the solution you're providing is patient centric. So you need to get the feedback from the community and understand that. So one size does not fit all. Definitely, you cannot just create a good platform, have the best doctors, and have a very strong back end and a system that gives you the best experience when it comes to user experience. But at the end, if the type of the service and the way that you're delivering it is not it's not up to the level of the community perspective and expectations, you can never serve to proceed to provide this service, and then you could never be able to think of what is safety and the other perspective of having a quality care. But when it comes to safety, I think it's having the perspective of the community is important, because safety is a socially construct concept. So what is safe in one country, I cannot call it safe in my country, and what is safe in your country is different from other country. So patient safety is something that's 100% patient centric, and it's a culture, no? And it's a risk perception for each community to themselves. So that's why even if you have a WHO guideline for telehealth, for instance, on a primary care unit, you cannot just go and implement it without getting the feedback and understanding what sound safe and what is sound good quality from the community that you're serving before you provide this. So all the guidelines and the governance framework you have, you need to test it first. You need to have it tested by the community you're going to serve, and then you need to have a regular audits and see how this cycle has either improved the outcome of the community that you're serving, or even sometimes it could be trigger and an eye opener to a different problems that you could never observe without having this kind of telehealth or a digital health solution provided for the community.
This is really, 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 really insightful. And I just want to add something which is going to lead me to the next question, because most times, because digital health solutions are virtual, we don't see them. Some of the times, like
Yes.
telemedicine, it's all online. We think we don't require resources for that.
Yeah.
But on the flip side, you also need resources to make sure that these things work.
Yeah.
So my next question, where I'm heading towards, is that I know that you've worked on a couple of things: reproductive health, refugee health, menstrual health, a lot of things. So how do you see digital health transforming these areas, especially areas in parts of maybe your country, for example, Egypt, where there is limited resources? So where you need, they don't have, say, they don't have internet, they don't
Mm.
have power, they don't have amenities that will help you to do your work. So how can digital health transform care in these areas?
Well, I think I'm hesitant calling any region in Africa limited resources, to be honest. I think we have a lot of resources, but you have a huge issue with setting priorities and know how to distribute resources. And we have a serious issue with sovereignty around health and healthcare in the region. And that's why and this actually will bring us back to the same point that we talked about the workforce and how the workforce is distributed in the different regions, and how we have a lot of trained people actually are usually practicing outside, but they're hesitant to come back and serve the community. So actually digital health could actually solve this, having this kind of like the platform that could link people from the diaspora back to their countries, for instance. But if we're targeting certain topics in public health, and even from my experience, I think despite that we have huge access and great access to information now, and especially with AI, you can just go and write any question, you get the direct and answer in no second. I think we have a huge problem with having a reliable, accessible, evidence-based information on sexual reproductive health, and especially for youth. The amount of information that we have online is massive, but we don't have something that is reliable, cultural, built, designed based on a cultural perspective, built for youth, and in a nice and attractive way that could actually help them navigate this period of purity, sexual reproductive health, around the youth health in a nice way, but also with keeping the values of privacy, how to help them protect themselves from rape, for instance, and from sexual harassment, and all the other things that we know that definitely require a lot of knowledge around it. So I believe having a digital health platforms, mobile applications that provide this kind of information is important. And I can see from the region that we have a lot of lately, especially platforms on digital health applications on sexual reproductive health. The problem is like mainly targeting women, but there are a couple of platforms that targets both men and women, and especially youth and adolescents around sexual and reproductive health. And I believe that was a golden opportunity for them. Like 5 years ago or 7 years ago, you wouldn't see this kind of uh, designed application and platform. You either get like a very rigid scientific information written in English that has nothing to do with your culture, or you have the material that we don't usually promote that usually promote rape culture and porn and whatever. So have something in the middle that has this kind of to bridge the knowledge and science for youth and provide information on sexual reproductive health in that way was a golden opportunity in my opinion. So for instance, if we're talking about Egypt, we have Love Matters Egypt. It's a very nice platform, and it's basically bridge this gap. But we also, if we look at the mental health, for instance, especially at the time of COVID, mental health services usually are seen it either as something a taboo that you should never go to a mental health clinic, or something that's very expensive that you can never afford. But within the time of the COVID, there is a lot of online platforms, especially in Egypt. Like I can name like at least 4 or 5 platforms um, started providing mental health support and psychological support through online platform with a very affordable prices. Varies from different regions, and a lot of people from even from the rural areas started having the ability and access to get this kind of services, which I believe is not only important for the patient to have this access, but it also reduces a lot of stigma around mental health. And I think this is a turning point in the mental health services in the region, that even started public health entities in Egypt started providing telehealth services because they witnessed how it's important and how they helped a lot of communities understanding their mental needs and health and mental health. So I think these are the two examples that I can witness from my experience around digital health in Egypt, and how um, they helped a lot navigating the stigma around, I don't want to call it limited resources, but the problem of having access to health due to different reasons, whether stigma or the design of the service itself.
Thank you so much for that. And as we begin to wrap up, so if you have any questions, you can put in the chat. If you're connecting from YouTube, you can put in the chat and we can respond to your questions. So looking ahead, say 3 to 5 years, what do you believe will be the major trends in digital health in Africa, for example, whether AI, telemedicine,
Mm,
whatever it is, and where should current professionals pay attention or invest their time?
okay, that's a quite difficult.
Yeah, I
Yeah,
know.
when you say AI, I cannot say anything but AI because AI is
No,
actually the huge umbrella.
just this is broad. What would be
Yeah,
the okay for
yeah,
digital health
yeah,
for you? This is for
yeah,
you. Leave AI out of it, or other things I
exactly. Yeah,
mentioned.
yeah, because I
Digital
know
health.
AI is
What
like
is which sector? Which aspect of? Because digital health is really broad. When we say digital health, it's a lot of
mm,
things, right?
yeah,
So
definitely. Yeah.
most times we think digital health is just digital health. It's a lot of things. Healthcare data
Yeah,
analytics,
yeah,
patients remote
yeah.
monitoring, predictive modeling, so many things make up digital health, so many other things.
Mm.
So um it would be nice to just hear your perspective, what you think is
Well, I think, yeah,
the major
as you
things.
mentioned,
And
it's a
me as a
huge
professional, if
umbrella.
I come to you now, what would you
Mm.
advise me to invest my time in?
I think everyone knows about AI, so I think it's something that you automatically learn. But I think what's important about learning AI, I think professionals who understand how to use AI in an ethical way. This is quite important. I think maybe we need some sort of like integrated medical classes or training, whatever, for doctors and healthcare professionals on how to use AI in an ethical way, and how to have the ethical lens while using those tools. Sometimes they're so tempting that you want to use them without thinking of the AI ethics, and how to protect the patient's safety around it. So I think, just a side note, I think it's quite important that we learn things about AI. But I think the major trend, in my opinion, but I'm not sure if it's something because I'm biased because I work in this area. I think the remote monitoring, patient remote monitoring. We have a lot of wearables now, and all the mobile phones. I think the smartphones now have this kind of like collecting information, and we have a huge information collected. So I think the remote patient monitoring and the platform on how to use data and how to integrate the data and analyze it in a way that could help patients is something that's very trendy now. So maybe this could be a good opportunity for people. And I think also it's quite important that people from the medical field understand this, because usually we depend a lot from those who are coming from an IT background to build a solution for the doctors. And usually this you have this kind of like the team from medical perspective with the IT. But also I think doctors themselves need to understand how those things operated at least, and how to understand how to design it and how to build it, so whenever they need to build something, they know how to navigate around it. I think also there is a major trend around having a public health infrastructure and real-time surveillance. So I think now a lot of countries have built very good public health infrastructure and digital health to have a disease surveillance system, and to know how to collect on-time data from the field, from the community health workers. And this will definitely help in outbreak control, and to actually be able to be ready for future pandemic if happen. So I think these two major things that from my experience and from my observation. And I think also there is a lot of efforts now for digitalizing the work, and the data driven from the community health workers to be digital, and to link it with the platform from the surveillance system, the national data platform within the community, and within the community health workers and the traditional birth entities, for instance. So I think those are the major trends from what I can see, yeah, from the
So
region.
taking that away from you, using AI ethically, patient remote monitoring, and of course, public health infrastructure, real time surveillance. Beautiful. And just a couple of questions before we wrap up. Um, how can one you've really gotten to a point, you're a Kofi Annan Global Health Leadership Fellow, and you got the AWID mentorship opportunity. So how do people position themselves to be able to get into these positions and opportunities as people starting off or mid career healthcare professionals?
Um, Actually, I think it depends from one person to another and where you're standing. But I think it's quite important that you ask yourself a question: that why do I need this opportunity, and what do I want to make out of it? So I think when I joined the Coffee and Global Health Leadership, at that time I felt that I've been working for quite a long time, and I need this kind of it's not education, it's not training, but I need to know how to navigate the challenges that I face at work. And what was important and very nice about Coffee and Global Health Leadership, that they don't teach leadership in a rigid way. They make you absorb the skills by observing the different experience and by witnessing leadership examples and so on. So I think it's important that when you're in a situation, you need to understand what exactly you need out of it, and then you start looking for opportunities that match your needs. But also I think it's important that you have uh, the knowledge and the expertise that would speak about itself, because sometimes we have a lot of opportunities and we look for a lot of people applying, but at the end maybe you still need the skills and the technical skills before you go for this program, and it would be a wasted opportunity, right? You need to have what you need to have before you apply to something so you can get the best out of it. But I think aside from this, as women, I think we need to know how to highlight our strengths, and we need to know how to understand our weaknesses very importantly, because sometimes we have this issue around, am I qualified enough, can I do that program, can I join, and so on. So I think it's important that you have good maybe connections around you to understand and to ask and to have mentors so they can guide you to the right program to apply for.
And one last question for the day, because we're almost at time. What is one practical step you recommend our community members to take this month or next month, because this month is ending, as we
Okay.
move closer to a meaningful role in digital health? What was one thing you can tell someone listening to us today to do before the end of this year if they want to get closer to their goal of working in the digital health space?
Yeah, I think actually community. And I think from what I see, that from the communities that I see, we do a lot of efforts. And I think we need some sort of like more support from the governance and the structure and the system support, more or less. But I think if I want to advise on one thing, I think maybe I would say, whenever they think of a solution, they need to think big. They need to think how this solution could be used in a larger scale, so they can have a sustainable model. There is a mindset that we call a marathon mindset or a sprinter mindset. So usually when you're having a startup or you work on a digital health and you're building your company, you have this enthusiasm and spirit, and you want to finalize everything quickly and you want to reach high position quickly. But I think you need the opposite. You need the marathon mindset. Even if you have something small, you need to think big. You need to think at some point, how am I going to scale it up? And how, if I ever get a chance to talk with the government, for instance, or on an institutional level, how they can use this solution to be scalable. Because I think they will reach a point where they would need the support from an investor or a government or someone who would ask them the question and how we can scale it up. So it's important that they think big, even if the solution is small.
Amazing. That's powerful to wrap up the session. We're exactly at 45 minutes, and this is usually
Yeah.
around 45 to 50 minutes. So thank you so much, Dr. Inas, for an amazing conversation. This was really
Thank you.
insightful. We've gone
Thank you.
from
Really
your
enjoyed it. Thank
career
you. Yeah.
to
And you give time to
problems of
someone to
digital
speak.
health, back to mentorship,
Yeah, that's
and
good.
all things in between. So thank you so much for spending this couple of minutes with us. And we wish you well and good luck in all your endeavors. And thank you everyone else that tuned
Yeah.
in, and have a lovely rest of your day. Thanks.
Thank you
Bye.
so much. Bye bye. Bye.